Hello everyone. This video I'm going to show you a case, a young woman who presented with growth in her left eye, upper eyelid, for 1 month duration, and she doesn't have any associated pain, and progression is also not there. She's saying it's not growing also, and uh, and when I examined, there was growth, small mass in the medial side of the eye, upper eyelid, near the upper punctum, and it was kind of umbilicated. So when you have a case like this, when there is a kind of a papule in the skin, so basically the lesion is in the periocular area, but it's in the skin. So there's a skin disease, skin lesion, and there's a papule, and there's a umbilicated dome-shaped lesion, which usually says that which is kind of a pathognomic clinical diagnosis for molluscum contagiosum. And the way to go forward is as a management is that although we have a clinical diagnosis, the only gold standard diagnosis have a histopathological examination, which in this patient we decided to observe, as sometimes it's self-limiting disease. In most of the cases, if the patient wants, I give the option of taking it out. We can either excise it out. There are other ways of management like a curettage or getting cryo, but since it is near the punctum, we have to be careful in this kind of location when you are doing destruct means when you are doing invasive procedures. So we have to keep in mind, and the option is the patient chose the option to observe, which also we support because of the proximity towards the punctum, and also if it grows, then we can always ask the patient to come back and the present management observation. But if patient wanted, we would have excised it, keeping in mind the proximity to the punctum. So whenever if this kind of lesion comes, we have to there are a lot of lesions in the eyelids, and in order to know in order to have a good idea about the diagnosis and all, we have to have a clinical acumen in this kind of condition, in every kind of condition. And in this kind of condition, the pathognomic thing is that we have a papule umbilicated dome shaped lesion. So that's what I wanted to remind in this video. Thank you.